Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss a topic which is very common, especially 1 out of 10 women are suffering from this. That is nothing but PCOS. For example, you have got a scan done and then there are some polycystic ovaries. Do you think that you're suffering from PCOS just by a scan? There are certain criteria which need to be fulfilled for you to get diagnosed as PCOS. So let us dive into the topic and know what are the criteria that need to be fulfilled. It's just not a scan, it's just not irregular menses. There are some criteria which need to be fulfilled. So let's dive into the topic to know it in a better form. What is PCOS? Remember, PCOS is a hormonal problem. It's a lifestyle disorder containing three main things. Everybody eats pie. So let's remember PIE. P for polycystic ovaries in the ultrasound or ultrasonography, I for irregular menstruation, and then E for excess androgen. Just remember, if you're suffering from PCOS, you have to fulfill at least two of the PI category. That is, which is polycystic ovaries in your ultrasonography, irregular or no menstruation at all, and then excess androgen. What is excess androgen secretion or hyperandrogenism? It's hirsutism, which is excess hair growth, especially on the chin, on the trunk area, and on the back, and then male pattern baldness, and then acne, which are persistent. So remember the PI. If you are fulfilling at least two of the PI category, that means you have PCOS. What are the signs and symptoms? Same thing, PI, which is P for polycystic ovaries in the ultrasound or ultrasonography, and then I for irregular or absent ovulation or absent menstruation. We can say hyperandrogenism. What is hyperandrogenism? Excess or persistent acne you will be having, and then you will be having male pattern baldness where there is hair loss, especially in this crown area, and then you will be having excess of hair growth on your face, on your chest, and also on your back. What are the additional symptoms? Weight gain or obesity. Remember, weight gain, obesity, and this PCOS, it is a cycle. Your weight gain can cause PCOS, and the PCOS will keep maintaining the weight gain. So remember, it is a cycle. Weight gain or obesity, insulin resistance, same. If you have a lot of excess weight gain, you will start developing insulin resistance, or you can go into diabetes mellitus type 2, which will again cause PCOS. PCOS will again cause weight gain, and this cycle runs over. Acanthosis nigricans. This is something that many people worry. What is acanthosis nigricans? Acanthosis nigricans, as you can see here clearly, is thickening of the area near your neck, as you can see near your neck region, and darkening. It is because of the hormonal disruption and also because of insulin resistance. Remember, even before you get PCOS, even before you get diabetes mellitus, there is a condition called as insulin resistance. So at this stage, your neck area will have this dark black color patches and thickening as well. If this is starting, remember that your body is going into insulin resistance. This is the primary picture presentation of insulin resistance. If this starts, then remember you're having chances of getting diabetes, you're having chances of getting PCOS, you'll get chances of having different hormonal disruption problems. And then what are the investigations? So let's dive into the investigations, what need to be done for you to be diagnosed as a PCOS patient. First thing is your LH and FSH ratio. What is LH? LH is nothing but luteinizing hormone, and FSH is nothing but follicular stimulating hormone. Remember, LH and FSH should be on proportion, like 1:1. But if you are having LH as 2 or more than 2 and FSH as 1, 2:1 proportion or more than 2:1 proportion, remember it is a sign of PCOS. Then testosterone, free and total. If you have a lot of testosterone increase, then that means you have PCOS. And all of the other tests which are below, like TSH, DHEAS, prolactin, all of these tests will help you to diagnose if you have other than PCOS. For example, if you have too much of thyroid stimulating hormone, it can be because of hypothyroidism, which can also cause irregular menstruation. Remember, it's just a symptom. If you are fulfilling PIE category, then that is PCOS. But if you're having TSH increase, then that will cause irregular menstruation, but it can trigger on a longer run PCOS, but starting you will have increased TSH. So if the TSH is increased, it can cause irregular menstruation. If we have androstenedione, which is a precursor for androgens, which is a precursor for testosterone as well as for estrogen. If this is increased, then on a longer run, you will be suffering from PCOS. DHEA. If you have DHEA more, dihydroxyepiandrosterone sulfate more, that means you have adrenal hormonal problem. Adrenal gland also secretes hormones. That problem is DHEA. Increase in that is because of adrenal and not because of your PCOS or your ovarian problem. Same with the prolactin. If you have hyperprolactinemia, it can also cause irregular menstruation. And then if you have this hydroxyprogesterone also, if you have disruption in that also, it might not be PCOS. These are just to diagnose that if you're PCOS or if you're suffering from an adrenal hyperplasia. This hydroprogesterone is caused by adrenal hyperplasia. So either if you're suffering from adrenal hyperplasia or adrenal gland secretions, or if you're really suffering from PCOS, you will be able to diagnose through this investigation. If you get your LH and FSH ratio first and your testosterone, if there is any disruption in this, then maybe you will be directly diagnosed as PCOS. If you're not finding any disruption in both of this tests and you still have irregular period, then go for the other test. Then other investigations which need to be done. First is your blood sugar or your insulin test. Remember, as I already told you, that insulin resistance will cause diabetes on a longer run as well as PCOS on a longer run. Okay, so fasting blood sugar as well as HbA1c, that is almost 3 months of your glucose tolerance, can be tested. Remember, if this both are normal and then you just feel like you might get, or you have a hereditary concept where your mother and father or your primary sibling is suffering from diabetes and you want to know if you are insulin resistant or you're going to a stage of insulin resistance, do the test HOMA-IR, where it will help in diagnosing on a longer run if you will be getting diabetes or not. You can get your HOMA-IR test done, which is homeostatic model assessment of insulin resistance. Through this test, you will be able to know if you're insulin resistant or not, or in the future if you'll be getting diabetes or not. Then lipid profile. Why do you want to know how much is your lipids or what is your lipid level and how is it connected to your PCOS? Remember, dyslipidemia, that is excess of very low density lipoproteins, which is VLDL, and low density lipoproteins can trigger or cause insulin resistance, and then insulin resistance can cause diabetes and PCOS, and then this whole cycle is again running. Okay, and then pelvic ultrasound. As you can see, if you get a pelvic ultrasound, if you can see, there are small dots here. These are follicles which are cystic, and these are in a pearl string appearance. If in your ultrasound you are getting a pearl string appearance, which it means that it is polycystic. Okay, so what are the primary tests you need when you want to see if you have PCOS or not? First is pelvic ultrasound, where you have this pearl string appearance of the follicles, first one. Second one, hormonal test, LH and FSH ratio increase. And third one is your hyperandrogen or increased testosterone level. Secondary tests are your diabetes or your glucose test. And third is your lipid test. And then remember that you also need your BMI assessment. If you are having more than 25 body mass index, you are prone to be overweight, you are prone to be insulin resistant. Next, let's dive into the structure and function. What is the physiology and anatomy of the female reproductive system? If you can see here, we all know we have pair of ovaries. Every female has a pair of ovaries, a pair of fallopian tubes and uterus. And this is the ovary. Remember, just to tell in a shortcut manner, the ovaries will produce a follicle, that is ovum. The ovum will travel in from the ovaries to the fallopian tube. Here, if there is fertilization, it will turn into a zygote and then you'll be pregnant. Okay, if not, but remember, the body is always being prepared for pregnancy. So whenever there is ovum release, the endometrial layer, the layer inside the uterus, will also thicken to hold your baby. Whenever there is no baby or no fertilization, this will start to shed, leading to menstruation. So remember, there is ovary or ovum releasing, and then it is coming here to the fallopian tube. If it is not getting fertilized, then that will come down along with the endometrial layer. There is ovum release, remember. Now let's dive into the functional part of the female reproductive system. If this is the follicle, here we will be having theca cells, remember. And this part is the granulosa cells. Okay. See, whenever we have LH hormone release from the anterior pituitary, this will affect the theca cells. And this theca cells will produce androgen. Okay. And this androgen will be converted into estrogen or estradiol, E2, under the influence of FSH and aromatase. Okay, remember, LH hormone will affect the theca cells and the theca cells will produce androgen. Androgen under the influence of aromatase and FSH will again convert it into E2 or estradiol. Just remember, this is happening near the follicle. Okay, now let's get into the risk factor section. See, risk factors, especially family history. What does the family history or the genetic makeup have to do with the PCOS? Remember, there are certain genes which help in excess production of androgen. So if you're having a family history of PCOS or genetic disruption or genetic problem in your genes where there is a gene for excess androgen, then you're likely to have PCOS. And then obesity, as I already explained in the starting, obesity can lead to PCOS and PCOS will help in maintaining the obesity. And then sedentary lifestyle leading to obesity. Improper sleep pattern. If you're not sleeping properly, there is hormonal disturbance occurring in your body, which is very slow, just like slow poison. It will creep into the body hormones and there is disruption in the hormones leading to PCOS. Remember, sleeping just at least before 1 a.m. is considered healthy rather than sleeping after 1 a.m. People who are sleeping after 1 a.m. are more prone or are at a greater risk for PCOS than people who are sleeping before 1 p.m. Next, poor diet. If you are consuming things which are high in trans fat or if you are consuming very high fatty foods, that will cause insulin resistance leading to PCOS. High sugar consumption as well. And then early puberty or irregular periods. If you are having early puberty because of prenatal androgen exposure or because of other lifestyle disorders, then you're more prone to PCOS. So what is prenatal androgen exposure? During pregnancy, if you're exposed to too much of androgen in your mother's body, then it is likely for you to develop PCOS in your adult life. And then ethnicity. People of South Asia, southern part of Asia are more prone for PCOS than the northern part of Asia. Then causes. Insulin resistance, as you already know. Hyperandrogenism causes PCOS, and then low grade chronic inflammation. So what is chronic low grade inflammation? See, if you are eating food which has high in fat content, it will cause inflammatory mediators to be released in your body, and slowly you will start developing inflammation. You will be putting on weight even if you're eating lower quantities of food, and also even if you're making healthy choices. Starting, you will face problem with weight loss. So if you're slowly putting up weight and if your health choices or your food choices are not good, then that can cause low grade inflammation. And then hormonal imbalance and then genetic factors, as we already discussed, can cause hyperandrogenism leading into PCOS. If you remember, there was a testimony by actress Vidya Balan where she told that she had followed almost all sorts of diets for weight loss, but she was not able to lose weight. But when she started the anti-inflammatory diet, even without a lot of exercise, she has come down to her normal weight. So remember, if you're putting on a lot of weight, even if you're doing diets or healthy choices and still you're not able to reduce weight, it means that you have some sort of slow grade or low grade inflammation in your body. Remember to eat anti-inflammatory foods which will help in relieving these symptoms. Body changes or the pathology, what you will experience or what your body experiences during PCOS. First, insulin resistance, hyperandrogenism, LH surge, E2 fall and even rise, and follicular arrest. So what are all these pathological terms? Let me explain or break it down to you in a normal language. As I told you already, if this is the follicle and if this are the theca cells and this is the granulosa part, remember that the LH hormone acts on the theca cells to produce androgen. Okay, and this androgen internally will be converted into E2 or estradiol or estrogen as we know by FSH and by aromatase. Okay, this is normal physiology. So what is happening is, if you consume a lot of sugar or if there is dyslipidemia, there is insulin resistance and IGF-1 releasing, which is insulin like hormone. What does this causes? You will have a lot of fat in your body. So whenever the LH hormone acts on your theca cells and produces androgens, these androgens are peripherally converted. That means they are converted in the fat to E1. Okay. So there is peripheral conversion of the androgen to E1 or estrone, which is as not as much as potent as estradiol or E2. Okay. And there is increase in E1 and there is decrease in E2. Okay, you understood this part. And when there is increase in E1, it will have positive feedback on LH. That means this peripherally converted, a lot of fat in the body will convert or will stop this conversion of E2, and this androgen will go near the fat and it will be converted into E1. Okay, there is increase in E1. This E1 will have positive feedback on LH. That means there is a lot of increase of LH hormone. LH hormone will again stimulate the theca cells. They will produce androgen and again there is E1 production and there is fall of E2. Okay. And then what happens? This E1 which is positive on the LH is negative on the FSH. That means it will help in production of LH and it will decrease the production of FSH. That is why you will be having anovulatory cycles, because LH and FSH together will help in releasing of the follicle or releasing of the ovum and its maturation. So remember, increase in LH will cause increase in androgens. So hyperandrogenic state. Hyperandrogenic state will cause male pattern baldness. It will cause hirsutism or hair on your facial areas, on your chest and your trunk. And also it will cause acne, as we discussed in the acne topic, which is hormonal and it is near the chin and it is also persistent. And also increase in E1 and decrease in E2, there is hormonal disruption. There is hyperestrogenic state, but it is not of E2, it is of E1. And because there is no FSH or very low FSH compared to the LH, you will have anovulatory cycles or irregular menstruation. I think you have understood the pathophysiology of PCOS. Now let's dive into the conventional treatment part or the allopathic form of treatment. Remember, if you are having PCOS, what will you be having? You will be having PIE, which is polycystic ovaries in the ultrasound. You will be having irregular or no menstruation, and then you will be having hyperandrogenic state. Okay, So hyperandrogenic state will cause what? It will cause acne, it will cause male pattern baldness and also hirsutism. So when you're visiting for PCOS, you have to visit first a gynecologist for your PCOS, and because you're having acne, you have to visit a dermatologist and a super specialty trichologist because you're having male pattern baldness, and you have to get your laser treatments done because you're having hirsutism or severe body hair on your chest and on your back, and also you will be having a lot of mood swings. Remember, women are tend to most mood swings because of the up and down of the hormones. We have a lot of hormones working in our body rather than in males, so we are more prone to mood swings. And remember, PCOS causes a lot more of hormonal disruption, that means a lot of mood swings. So you're sort of in depression, sometimes anxiety, so you have to consult a psychologist or a psychiatrist. So you have to consult a lot of doctors for just one problem. So let's see what treatment they are giving. First is combined oral contraceptives or COCs, and then progesterone only pills. These are two hormonal tablets that they give you so that you will have a maintained level of hormones. But what are the problems in giving combined oral contraceptives or progesterone only pills is that by giving external hormones, your body is under influence, so you'll have a lot of mood swings. First thing. Second thing, you will start having or putting on weight for no reason, although there is research which is strong telling you that a lot of contraceptive pills will have effect on your water balance in the body, leading into weight gain. Even though you're not eating much, the body will start holding on water a lot. And then what are the problems? You will not be able to conceive, and also this treatment is like ongoing. It will not give you a permanent cure. Even if you search in any Google search engine or chat GPT, they'll tell you there is no cure for PCOS in allopathy, because it is a lifelong process where you should be using this contraceptive pills. If you stop using contraceptive pills for 1 or 2 days, you will experience something called as mid menstruation or spotting. So it is a ongoing lifelong process and you will not be able to conceive. Next, metformin. They will be giving you metformin for your insulin or your diabetes mellitus type 2, and these drugs will help you in getting pregnant. But remember, if you're using all of these anti-contraceptives, you're using oral contraceptives, and then you're using drugs which help you get pregnant, your body is under influence of a lot of hormones. It will have a lot of changes. So whenever you are taking a hormonal pill, just think, are you doing what is right for your body? Are you giving it cure? And then let's get into the other forms of conventional treatment where they are giving you statins to lower your cholesterol level or correct your dyslipidemia. And then they are giving you surgical options of laparotomy or laparoscopy to remove the cysts. And then they're giving you antidepressants because of your mood swings. Remember, there are a lot of medication that you need to take for just one problem, which is PCOS. And remember, all the statins, the laser treatment you're getting done, the nutritionist whom you're consulting because you need weight loss, and then you're going to a general medicine doctor for your metformin treatment. You're consulting a gynecologist for your hormonal treatment. You're consulting a dermatologist for your acne, a trichologist for your hair. You have to consult so many doctors, so much of medication, so much of mood swings, and yet no cure. Here we come into action with homeopathy. So, how is homeopathy helping you in treating PCOS? Here at Fidicus, we have all-in-one program where you don't have to go to different doctors. You have a nutritionist who will help you in getting a better shape or in your weight loss. And then we will give you drugs which are not as much as many as allopathy drugs, which are tailor-made just for you. That is, whatever you're facing or how your problem is, if it is genetic or if it is because of your uncontrolled eating habit, we will educate you, we will counsel you through your depression, we will give you medication which is palatable, which is soft and yet very effective. We have a lot of cured cases of PCOS at Fidicus. So remember, next time if you're feeling like I have PCOS and there is no cure, or I will not be able to conceive because I'm having PCOS. It's a lifestyle disorder, and also it needs medication which is just for you and which acts internally inside out. You don't have to consume a lot of hormonal tablets, you don't have to consult a lot of doctors. Here at Fidicus, single-handedly we will give you what is tailor made for you, and then we will be giving you nutritional advice and also lifestyle changes all in one just at Fidicus. Now let's get into the precautions of PCOS. No matter what sort of treatment you're taking, precautions are always necessary to either counteract what you're already suffering from or to stop it. So what are the precautions? Weight reduction. Remember, insulin resistance or eating a lot of high fat food is causing insulin resistance, weight gain, and PCOS, peripheral conversion. So weight reduction is the main agenda of your PCOS. If you want the PCOS to go down or you have to stop it, you have to first reduce your weight and make healthy lifestyle choices. For example, you are living in an area which is 1 kilometer from your workspace. Instead of driving, just walk, okay, and increase your exposure to sun, so that you will have a maintained level of vitamin D in your body. And then stress management is very important, because the more you stress, the more amount of hormonal imbalance, a little bit more progression in your PCOS. Try maintaining your stress by working out daily, consuming lots of good healthy food, and also drinking good amount of water. Here at Fidicus, we have two kind of consulting options. One is online consultation and another one is offline consultation. If you are nearby in Manikonda, you can come and here visit us through offline consultation. If you are anywhere around the globe and you've seen this video, you are suffering from PCOS and you want effective cure, then you can consult us online through this number which is visible here, either through WhatsApp or through call. And on online we have two features, which is audio call and video call. Remember to call or WhatsApp us on this number. And if you are suffering from PCOS and you are not here in India, your medicine will be shipped to you within 5 to 6 days if you are out of India or USA. If you're staying in USA and you like to visit us, or you have already taken doctor consultation and you need medication, your medicine will be shipped within 3 to 4 business days. If you're anywhere in India, then it will take about 3 to 4 days for your medicine to reach you. If you're suffering from PCOS, why do you want to choose Fidicus Homeopathy? Here are some reasons. We stand really tall with our highest success rate. The personal care we provide here is of highest quality, and also the medication is transparent. So for safe as well as effective homeopathy, choose Fidicus. Thank you.
Fidicus Homeopathy.